Okay, in the video, a renovated unit is shown. Where is this, which unit? That's a model. It's a picture of what we kind of hope the unit will look like, and the first unit that we're renovating is 1 East, so that is not 1 East as it exactly would look, but it's to show you what the common area would look like and what the hallways would look like and what a person's room would, just to give you an idea. We wanted to try and put a picture to it, so it's not an actual picture of a unit yet here. How do I get a food card at the cafeteria? I think there's a sign, I just was reading it today. It's in there, it's a big poster. It says how to sign up to get one. So I'll kind of direct you there. What are the RA3 positions and what are the qualifications needed? The RA3 is a new classification. We haven't posted a position yet. We will in the short term. And there is both a job description and the question came around what are the qualifications are also in that position. So I would direct you to that. If you could just wait, be patient. We should be posting soon. And if you really need an answer, I guess you can approach HR and see if they can give you the information ahead of time. But I would encourage you to wait, if you could. Transition school classroom. Due to the increasing injuries and near misses that staff are incurring and the creation of the crisis stabilization unit, will people working these units have increased pay? So we are looking at different classifications all the time, and this is an area that we're very much aware of, and where the job will require additional skills and training, and we can really articulate that it is more complex or different than the jobs we have right now. We are definitely looking at new classifications. If a staff member is working with a resident who is moving to a community home, what does she need to do to be able to still work with this same resident after the move? The answer is you just need to apply with, and I'm assuming in this question that the person is moving to a home that we own and operate. But same answer, if they move to supported by another organization like Dash or New Directions or Pulford, they will be looking for people. And I would suspect that if you have experience with that person and you're also wanting to remain connected, you'd be a pretty good candidate. When a resident moves to the community, do us, the people who have worked with them for a long time, are we able to visit them in their new home? And the answer is yes. You can make contact. Some staff are even kind of bringing that up ahead of time when they know the person's moving and just saying, I'd really like to connect with the person after they move. Is that possible? What arrangements do I have to make to do that? Can we have lifeguards in the pool area? And can we provide swimming lessons to staff and volunteers who would like to learn? We would like to get a lifeguard. Ever since I've arrived here, the pool has been a topic for, I know we've all worked really hard to try and make it more accessible to people. With that has come more use, and with that has come, maybe we need a lifeguard. Maybe we need somebody kind of in charge of the pool. I can't stand here and say, we got a lifeguard, they're starting Monday, but we are looking at it very seriously. So we hope to be able to give you some information in the near future. If future plans include the DS community programming staying here, has any thought been given to giving them a centralized location, for example, part of a living unit? This would accommodate all their storage needs, change areas, maybe even a kitchen, all in one place, not spread out throughout the numerous rooms. Also, maybe even a quiet area for an individual who may need some individual space. I'm not sure this is a question as much as it gives us something to go look at. There's some things here that make sense. So can you leave this with us? Would you consider staff doing performance appraisals on their managers? Would this not enhance knowing where the leadership is perhaps struggling? Yes. With the 360s that we talked about, that the directors have all completed, we're moving that down into different layers of the organization, and that's exactly what they do, is they provide a mechanism for people to provide feedback positive, kind of constructive, supportive comments on how leaders can develop to meet the needs of staff. This next one is just palliative care resources. So I'm assuming from this that the person who wrote this thinks we need to have more than what we have right now. I know, depending on what part of the organization you're served in, we do have relationships with the palliative care folks at WHA. I know that from a fact here at River Road. I know that also for a fact for some of the people in the community from time to time. There's also the Voluntary Palliative Care Association that we link with sometime. We've had staff that have gone to some specific training to, and I'm talking about direct staff, care staff that have gone to palliative care training, and I would expect if you're one of these people who would like more of that, if you could let somebody know in a leadership position, we can then try and figure out if that makes sense and what makes the most sense of where you to get that information. I think we're always looking at ways to enhance our relationships with these folks. How many staff do we have now? Because in the 2020, right, vision, it's 2,000. We have 1,700 right now. Okay. Do you envision a job loss in the next 5 years in dietary? No. That's a simple answer. No, we don't. Many, if not all, activities mentioned in the list of strategic planning targets are in regards to leadership, supervision, directions for this or for... How can this planning even occur when DS has been without a permanent manager for over a year? It's no reflection on the current acting managers. It's about planning, and it's about process and being able to have somebody in charge that can move things forward. So we are aware that we've been working with acting, and actually I just want to say thank you to those people who have been. That's a shared role and a very valued role. And it does connect to another question that's a little bit deeper in the pile here. Around, we have been talking about our community day services and DS, or day services that we provide here, and talking about, as we move forward, separating the two. And you saw in the 2020 vision, we talked about at some point we'd like our community day program to have a location other than just here at River Road. So in moving in that direction, we are getting close to looking at aligning some of the services a bit differently, which would include the community day services being aligned. Once that alignment's occurred, then we'll be able to move forward with filling the leadership role. And I can probably say to you within the next few months, we're not talking a year, okay? When are the One East renos to start? They were supposed to start a while ago. And if Rick was up here right now, he'd tell you how many meetings he's had with the City of Winnipeg. And it's actually very simply come down to zoning issues with the city. And we've made good progress, but it took a long time. So I believe we have a date pretty close where we're going to actually start the demolition construction phase. Okay. So within the next few weeks, we hope. Are there any plans to expand the school and the resources for the staff and students? Yes, there are. We've actually been meeting with the Department of Education over the last number of months to revisit what we would see, clarify our role as a school within the Manitoba education continuum of services. We have absolutely confirmed that we have a role, and they would like us to continue to play the role we have, but we've also talked about doing assessments out in the schools more often, and also having students maybe come here for 12 to 16 week assessments. So what we're doing is we're adding to our menu of school services. We've even proposed to Manitoba Education that if you ever had a classroom out in one of your divisions, we'd actually be quite happy to teach in that classroom and to use that as a site to have people transition back. So those are all concepts and ideas that are being discussed, and I think are actually quite exciting. My clients have enjoyed utilizing the new counseling services and report great benefits from it. Will the service be continued? We have someone, I think if you remember, I'm sorry, I forget our staff member's name, who's been doing the counseling, but I've heard the same thing, lots of positive about people who are able to access that. Once her practicum is done, she was part of a family center, and so there is counseling still available, and it's on a sliding scale. So if there's anybody that needs counseling, it will be available. It may not be available from the exact same person as we move forward. James Ediker and I just talked about this a couple of weeks ago. What is the organization's commitment to the health and wellness of their employees? Okay, I like this question. We have a gym. We encourage people to eat healthy food. We've revised our menu to include more healthy choices. We've embraced mindfulness, and in the mindfulness toolbox, we're trying new things. We've tried yoga, we've done some meditation, we've done mindful eating here. We had a little trial on that for a while. We're open to people's ideas on how to increase wellness. We have a wellness committee that is constantly looking at issues and bringing suggestions forward. I remember when I first came here, one of our dietitians ran a group at lunch around, how can you eat better? And I went for quite a few weeks. I learned a little bit. So I'd encourage you, if that's offered again, to take that. Will the DS staff be certified in CPR for pool and client safety? We do not certify them all right now, but actually I asked Peter this question and he assured me that we are actually looking at it. It's not a decision that we've made yet to say we're doing it, but we are looking at that. Is the pool getting a full-time lifeguard? We talked about that. Why are the units, school, and DS understaffed? I've talked about understaffing before in the context of River Road Place, and that we've identified historically numerous times to our funder, the Winnipeg Regional Health Authority, that the number of people that we have living in this building and in the space that we have with the number of staff, we are understaffed. So that has been what has been the reality here for a long time. We did get some new money for 3 years of visioning money. It wasn't as much as we would have liked, and it doesn't allow us to provide the same level of services that people in the community get. For sure, for day services, it doesn't, and we've talked about that. Part of our strategic plan is by reducing the number of people that live here, but by keeping the same number of staff, that we will be able to, in essence, have more staff. It will feel like there are more staff around because there are fewer people to look after within that same complement. And casuals are available but not being called. Without knowing where you're from, I can't tell you anything other than if you're a casual and you're not getting called and you want to get called and you think there's a problem, can you just let one of the HR staff know and maybe they can help link you with the person who can work on that. Thanks, Chris. So after 2020, are you saying that there will be no long-term residents at River Road Place? No, I'm not saying that. We have individuals right now that we have been very clear that we're not proposing transition planning with them, so those individuals will likely still be here in 2020, and I expect many of them will continue to remain here for years after 2020. So there will be some people who have lived here and who will continue living here, but there will also be some of the people that will come and leave, that will be here for more shorter term needs. Family engagement. For goals in any system, consumers need to be family of consumers need to be engaged. How is it the WHA survey was not tailored to families, to engage families, the folks who receive the services? Specifically, the survey is an employee engagement survey, so it's very much focused across all of the WHA on the employees. So it wasn't, that would be, I'd almost say, a separate survey for family engagement would be something that that we could look at. Looking at 2020, I did not hear anything about my child being here, which is not my choice of accommodation. So this speaks to the issue of the question, will there still be some of the same people that are here today living here in 2020? And I answered that, yes, there will. And we've been very clear about what it is that the criteria that we would see as being helping us to make that decision as to who would benefit from the services that we'll be offering in the future. When will developmental services in River Road Place become two separate departments under separate management? So that's what we're talking about, the alignment of community day services separate and apart from DS. And we're working on that right now. Is 1 East going to become a respite unit? No, we don't have a plan. I know in the vision we said that there would be one unit that we would hope would be accommodating around 10 people, and we have not identified which unit the respite unit would be. Can we have, I think this is a bus pass monthly. So I'm not sure context of that.
Subsidized bus passes.
What?
Probably subsidized.
Oh, can we have subsidized bus passes? We would have to, I don't know much about this other than, look, you enter into an agreement, like U of M, right? They got an agreement for all their students for a reduced bus pass. So if the question is, could we approach, I don't know, if there's an... We do it?
No,
We don't?
WRG does not have it in their STAR.
The WRHA does not have it in their STAR kind of offerings. Yeah. Sorry, I can't hear you. Red River College does it, U of M does it. We don't, and I guess the question would be, is it possible for us to do that? There is a cost. We don't have it on our plan right now. Can you know, I'll ask a couple of questions, but I won't guarantee anything. Is there a possibility that the parking fee will decrease in half or maybe make it $5? Yeah. Probably not. $5, that's, yeah. I hope that doesn't mean a day, does it? No, okay. Okay, that's all those questions. It would be really nice if we could do away with the white bibs and use them only when eating. Instead, every individual that requires wearing one can have scarves or bandanas made for them, or at least have some made for each living unit to use. It looks so much nicer and less institutional. In DS, some more absorbent ones were made for when we go on outings. The people's eyes even light up when we bring them a scarf or bandana to wear instead of a white bib. Excellent suggestion. So, can we make that happen? I think we were making it happen. We can become much more deliberate about that. Yeah. I'm going to have to, I've got a couple here that I'm just going to, they're not going to be read as they were written, just because there's some sensitivity in the, but I'll try and get to the essence of them. I am troubled about the intolerant sentiments I hear against some people of different cultures that work within this, within St.Amant. And I've heard such sentiments around River Road and from staff. Then it goes on to say, providing compulsory cultural sensitivity training. This person specifically says that the Aboriginal Cultures Awareness course was insightful and profound as it shed light on the effects of the residential school abuses. This course is an excellent start, but more training is needed. It goes on to say that many of the people that we support are also come from different cultures, so it is inherent on us to be able to understand their needs and speak respectfully to, in front of them, and I think it was both, this is being addressed both to people we support and to the staff that work within our organization. There's been a lot of movement and change in the leadership in the autism programs. Why? Are people unhappy up there? If so, why? Okay? There has been some change, significant change, I would say. When Dr. Cornick left that area, we created, we reorganized a little bit, and we created a director role, and we created a senior manager role. We held open competitions for those positions, and we are building a new team. With building a new team, with new leadership, sometimes people decide it's time to not engage and maybe try something else. And I think I've stood here before and said to people that we are an organization that if we're not the right fit for you at the right time, we'll help you find something else. And maybe, in the end, you'll come back to us, you know, at a later time, if it works out better. But there was some pretty significant changes in the people in autism, and I would just say this to you, that when leadership changes and there's new people brought in, we have to give them a chance to be able to find their way and build their team. And we're very early into this journey with this area, so I think, yes, it's acknowledged that there's change, but if I could say, if you look at the actual outcomes and who were there to serve in that program, the quality of the services through this change, we've absolutely not missed a beat for those kids and their families. So yes, there is some change, and I'd also say that what contributes to some of the issues within that area is we have a growing, substantially growing waiting list, which if you're a staff member working in that area, sometimes you feel a little bit helpless when these families are continually asking you for help, and the funder won't give us any more money. We've continuously sought money and presented new options over the last while. So people have been working really, really hard to respond to some significant change issues that aren't just specific to the people changes, but they're also the political environment and the substantial waiting list, etc. So that's how I would choose to answer that question. Can you guarantee that St.Amant is done with appointing people to positions? And I will not tell you that we will not appoint again. It is the management's right to appoint people to positions when we feel it's the right thing to do. Now, what I can say to you is, recently, when I've been involved in those kinds of discussions, what we're looking at is an area where there maybe has been significant change, and we want some stability, and we need a good relationship with whether it's our funders or our parents or et cetera, and we will make a decision that's in the best interest of the organization. We will continue to do that from time to time. The majority of positions will be open competition. But for me to say we're never appointing again would not be a responsible thing to communicate to you today. And I think that's all the questions I have, unless anybody has any others. So thank you very much for engaging. Oh, sorry. The question is, are we looking at a new program area or a new, and this speaks to the whole issue of alignment of our existing services and growth. We've been having some discussions amongst senior to middle management of late around what would make sense to possibly align as services to create a new area so that the existing areas aren't continually just added to and forced to grow to such a size that they're struggling all the time. So we have been looking at some specific areas, and have day services is community day services is one of those areas, and then some of the areas that have been a responsibility in community residential. We've been talking with those folks quite openly about the areas that might make sense to combine with the day services. So it is about ensuring that we have leaders who have the capacity to support our organization as we move forward and not overwhelm them with volume of work and complexity of work. And as you can see, we are taking on new initiatives and new projects. You know, every year there's a couple new ones. We have in our plan with community residential services the 5 homes a year for the next 4 years. That's substantial growth. And we also want to grow in our supported independent living area. We want to create more innovative residential options for people. So we need to pay attention to that. And our foster area, where we just talked about we need to go out and recruit 10 homes. And I can guarantee you if we do a good job, they'll be back on our door asking us if we can do some more. So we'll have to make a decision at that time. But that's usually how it goes. If you do a good job, the funder's back on your doorstep asking for more help. Hopefully that gives you an idea of we're headed in this direction. We haven't made any firm decisions. When we do, we will absolutely communicate what areas we are aligning together. And if that opens up a new opportunity for someone, we'll be communicating that too. Anything else? Jack? Swipe cards? Okay. Yeah, I'm not trying to dance around the question, but I don't know all the specifics of how to get the swipe card. But can someone from Nutrition Services help? Tracy, you'll help? Tracy said she'd help you figure it out.
That's for volunteer swipe cards.
For volunteer swipe cards? Oh, sorry, I thought we were talking about the kitchen. Yeah, so I'm not even on the right question. So Tracy said she will help you with that question. Thanks. And there was another one, I think? Another question or no? Yeah. Tandy?
We were in the process of changing our designation under the Vulnerable Persons Act.
That's right.
Why are we changing, and what are the pros and cons of changing?
Yeah, sure. That's a good question. Thank you. We are right now designated a developmental center under the Vulnerable Persons Act, and I believe I have talked about this before, and as is the Manitoba Developmental Center in Portage, so there are 2 developmental centers. When we looked at what we want to provide to the community as we move forward, a developmental center is historically has been an institutional environment that provides long-term care to people with intellectual disabilities. And in our case, it's been both kids and adults. In MDC's case, the last few years, it's been primarily adults. So as we talk about what we want to become here, we honestly think that if we remain a developmental center and don't change, that I've stood here before and said that our critics will come because we will eventually be the last one in Canada, and they will demand the closure of the last developmental center in Canada. So by moving to the healthcare center designation, which is what we are heading to do, we will allow ourselves to continue to be able to provide services and not be at risk of closure by those critics. So when you talk about the positives and the negatives, by changing our designation, I believe it allows us to continue to provide services for a much longer time, and to do that with a health care, crisis stabilization, and crisis mandate in the future. No. A matter of fact, the funding has nothing to do with the designation. Some would argue that under a health care model, you might get an increased funding. The argument that we've been, or the case that we've been putting before the WRHA, who funds most of the services within this building right now, is that as we reduce the number of people that live here, you cannot reduce the funding here because you've been underfunding us historically. And the reduction in the number of people that we have living here is about improving the quality of care to the remaining people that live here. If you decrease our funding, you will be placing them at risk, vulnerable people at risk, and working directly against what this organization thinks is in the best interest of the people that we support. We think we have a pretty strong argument, and I could tell you from the funders that I've talked to, the leadership people, they don't push back. They're not coming and saying, we're going to take some of your budget, because we have a very, very strong argument for keeping the money within here. What we're saying is we're going to do it, we're going to use it to serve fewer people and provide a better service to those people. And if people can return to the community, if they can just come and utilize our services for respite, crisis, or for complex medical care for a time period and return, that would be our ideal. Now, I know there's also the question about what about the people who have lived here for a long time. We are still committed to those individuals that we've identified that need nursing care into the long term. But I can also tell you that at some point in time, I expect we may have homes that have nurses working in them that might be able to provide some of that complex care in a community home. But until we can, our commitment is to have those people who are more medically fragile continue to receive services here as they need it in the 24-hour nursing model. So in the future, we move to more of a health focus. We move to more of a designation truly reflects what we will become. And takes us somewhat out of, I think, a high-risk situation. So hopefully that answers your question. Anything else? Sorry, one more? Yeah.
Who's moving to the third floor secondary building?
I don't know, and are we ready to say that? Do we know for sure? It's not quite finalized? Okay. Not quite finalized, but we're close. Is that it? Okay, thank you. Awesome questions, people. Thank you very much. And thanks everybody for coming. Bye-bye.